As a jury participating in this case, it is to my understanding that the plaintiff's personal files were left open on the desk of the staff in the front of the office for anyone who was there to see. I also understand there was a very confidential piece of information taped to the top of the file along with his name and date of birth. According to the HIPAA law of 1996, it clearly states that the HIPAA privacy rule gives patients certain rights over their health information, including dental records and billing records. For example, patients have the right to ask for a change in their records, ask a healthcare provider not to disclose their information, ask a healthcare provider to communicate with them confidentially at an alternative location or by an alternative means. The healthcare provider must accommodate reasonable requests. Now, the plaintiff did not mention whether or not he asked the physician to not disclose information that includes leaving the files out on the desk. The ladies at the desk should have been aware of the laws that they are breaking by leaving this information out for anyone to view. There are forms that you fill out and sign initially as a new patient stating whom you wish the physicians to disclose your information to, family, friends, etc. It also asks you for the names of these individuals. These are people that you have selected for your information to be given to if you are unavailable to speak with. These records are confidential and should not be accessible to those who are not authorized to handle or view these types of records. No changes are to be made to these files without the patient's authorization. There were no changes made to the plaintiff's files, but his information was left out for anyone to view along with several others. They should be kept safe and secure to protect the patient as well as the person handling these files. After reviewing both the defendant and the plaintiff's arguments, I am ruling in favor of the plaintiff due to the fact that he was at the counter with multiple individuals and was not being tended to, but his files were left open and many people were in bird's eye view of these, so anyone could see his information laying there. The information included his date of birth, his address, his name, and a very important piece of information was the AIDS sticker that was taped to the top. Now, that is very confidential information that you do not want anyone to know about. That is for you and your physician's confidential matters only. In this situation, the file should have been obviously closed and kept in a secure location, which there were no security measures taken to protect anyone's information in this scenario. The sticker, however, could have been placed on the inside of the folder so that no one had view of that at all until the nurse or the physician were to open the folder to see that there. The patient once was at the counter, obviously, and then he looked over and saw his information laying there. Now, this put in view for all the nurses behind the counter, anyone that was standing in the front of the counter along with him. So now they have his information as well as the nurses that are behind the counter, which technically they're not supposed to see that either. If dentists do not comply with the HIPAA rules, then when they get audited, they can also get penalized for this. This is a huge breach of security and many levels. There are many levels of security in the physician's office. These files should have been put away in a secure folder or put somewhere where no one else can see them until the patient's turn at the counter, and then you pull the file out so that you can see their information there and you can share that with them. And then when the patient's done, you close it and put it back in a secure place. The dental records in paper or electronic format are considered protected health information and are subject to the same federal scrutiny for privacy and security as full medical records. Dental records contain minimal medical information, demographic information such as name plus any numerical identifiers related to the dental health include address, birth date, phone numbers, insurance status, patient ID number, and social security number. Penalties vary and are determined by the seriousness of the security or privacy breach. Also taken into consideration are whether you knowingly or accidentally release patient records and private information. Either way, you're held accountable. Penalties range from fines to being fired from your job to closing an office to potential jail time in the event of knowingly losing 500 plus PHI records and failing to report to the HHS within 60 days. There are also risks of the nurses sharing information between each other as far as the patient that's there, and when the patient leaves, if they see the information laying there, then they also share the information between each other, which is also a violation of this law. So after reviewing the case and after reviewing the defendant's file as also the plaintiff's file, I again say that I am ruling in favor of the plaintiff due to the fact that his information was left out. The security breach was violated, obviously, and the HIPAA rules were not being followed in this particular situation.